Hi, Max. I'm early. Just wanted to make sure I was on.
No, that's okay. Lori, can you hear me all right?
I can. Can
I
you hear
can.
me?
Yes, absolutely. Thank you. I'm
Excellent.
never sure with this.
Yes,
So,
I'm always checking each time.
but thank you for joining us. I appreciate that.
Sure. Yeah. So
And
I will hang back and wait and see what questions folks have. If there's anything in particular that you think that I should touch upon.
I
Um,
think that it would be good to get a horizon view of what the CDC may be thinking for their own, because that's what the governor's relying on.
mhm,
So what's the CDC thinking possibly of extending even their allowances or provisions for evictions,
mhm.
and how things have been in the community in general. What have you heard? We've heard anecdotally, that some people are still getting evicted even though we have a moratorium, but it's all done after the fact. It was long since done. So yeah, whatever information along those lines you could provide would be great.
Will do. Okay.
All right.
I'll let you prepare. And I'll
Okay.
do some more notes too.
Yeah.
Thank you.
I think after yesterday, everything else is just boring.
I know, really.
Rich, how are you, sir?
There we go. How you doing?
All right, how are you?
Ready for a big crowd?
We'll see. You never know. Actually, speaking of which, let's see who's here. It's just us three at the moment. And whoops. Yeah, okay. Well, hopefully it won't get hacked into. I did report that last incident over to IT. Apparently, whoever bombed the meeting was routed through Greece. That's all we know. So
I didn't know that happened.
yeah, sorry. If you in the chat area, hi Peggy. In the chat area,
Hi.
if you're looking, there are a lot of racial epithets being put in real fast, like it was a program being launched, and it just went on and on and on. I was finally able to catch up with it and get them out of there. All right, hold on. And now my wife is asking me what time I'm going to be home. Okay.
Hi, Peg. Haven't seen
Hey.
you in a while. I know it. Not in the office.
The craziness never ends, huh?
Yes.
Have you heard anything, since we're chatting, I'm trying to get a handle on the new federal COVID bill because there's all this rental assistance in there, like $25 billion for the country. And it's like about $500 million for Massachusetts. But
458. Yeah.
yeah, we were trying to, sort out like, how's it going to flow? Like whether they think it's going to flow to the people that usually distribute raft or whether it's going to go through a broader network. I don't know. Have you heard anything on your end?
Yeah, I think much broader. And I think there can be, there is the option for the city versus the county. Well, I shouldn't say versus, but plus the county. So,
But you have
in
to have
tandem.
200, don't you have to be a population of at least 200,000 to go outside of the state process, right?
Right. So Essex County qualifies. And so there's the option then, with the county and working with the larger cities within the county.
Huh.
And I have some other notes too on that. I don't know how handy I have them at the moment.
I'll
But
follow up with you because the mayor had emailed me today about it because she had gotten something through a separate listserv or whatever. And I had done a webinar yesterday on it with the national folks that oversee community action agencies. So I'll follow up with you about that. Because
Yeah.
we do have I know our statewide association is trying to be active to make sure that agencies like ours and other community-based places can do it as well. Because they have to spend the money down quickly too, by
yeah,
the end of September, which is, I actually probably won't be that hard because the rate at which people are applying for rental assistance is incredible right now, so.
it is, but you still have to process them and there are people processing them. So it's not a computerized thing. I think that there's a real national recognition that the local administration is the way to go. And so as deeply local as you can make it and arrange for it, it's the best way to help folks. So I hope they continue with that when the decisions about the actual flow, I hope they continue with that, focus. The more local it is, the better we can help folks more quickly and more nimbly, I think.
Hello, everyone.
Hi, Claudia, how are you?
Claudia,
Good, how are you?
Hey,
Happy New
Claudia.
Year, everyone.
Good.
Joe
Yeah.
and Rich. Hello, Carol McMahon. I don't get to see you often. That's nice.
Hi, Carol.
do we know, is Rob coming?
I think Rob, he's
There
right.
he is.
And Karen, can you hear me? You're on mute. Karen's trying to join by phone.
Good.
She has to move to Gloucester.
And Max, is that you, the M?
Hi, Max.
Yes, it is. Oh, there she
Okay.
is. Okay.
I'm here. Thank you.
Good. Hi.
Hi,
Hello,
Karen.
Karen.
Hello, everyone.
I
Happy
think the
New
whole
Year.
gang's here.
Hi, everybody.
Hi, Rob.
Do we get started? I think everyone's here.
I think so.
All right. Welcome, everybody. This is the Gloucester Board of Health meeting. It is January 7th, 5:30 PM with a remote meeting. And I have to read this. This meeting is recorded by video and audio in accordance with the state open meeting law.
Did I miss it?
Consistent with the governor's order suspending certain provisions of the open meeting law and banning gatherings of more than 10 people, this meeting will be conducted by remote participation. If you are calling in on a phone, you can press *9 to request to speak. If you're watching on a computer or device, there is a raise hand button that you can tap or press to request to speak. Please use either of these options during all communications to be recognized to speak. The listing of matters is those reasonably anticipated by the chair, which may be discussed at the meeting. Not all items listed may in fact be discussed. Other items not listed may also be brought up for discussion to the extent permitted by law. And the order of the agenda may be changed at the board's discretion. And I would ask that people mute themselves if they're not speaking. All right. Introductions of the board. I'm Rich Sagel, the chair of the board. We have Fred Cowan, Joe Rosa, Claudia Schweitzer, and Rob Harris, the vice chair. We have a number of guests who will introduce themselves as they have a chance to speak. We also have Max Shank, Bobby Hernando, the recording secretary, and Karen Carroll, the director of the Department of Health. With that out of the way, Public oral communication. This is the time for anyone in the audience to speak on any topic for up to 5 minutes that is not on the agenda. Is there anyone so wishing to speak? Seeing no response, we'll move on. Approval of the minutes. We have 2 minutes to approve, November 5th and December 10th. Any additions, corrections, deletions?
Chairman, I'd like to make a motion that we approve the minutes of November the 5th, 2020 as written.
Second,
Any final comments? Hearing none. All in favor?
Aye.
Aye.
Opposed?
Aye.
Okay, and December 10th.
I make a motion to accept the minutes of December 10.
Second,
Any final
I
comment?
abstain from December 10th.
Okay,
I wasn't present.
all right. No comments. All in favor?
aye.
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 All right, moving on. No committee reports. New business. Cape Ann Mass in motion.
All right, Jennifer, you're on.
Great, thanks. Hi, everyone. I thought you might want to hear some positive news for a change.
Well,
So I am here tonight to update you on things that I've been working on during the pandemic as your Mass in Motion grant coordinator. And I will be talking briefly about the over $390,000 that we have received in various grant funding during this difficult pandemic time, and how our work is related to a lot of what we are seeing going on in the world of COVID and, health equity. The first topic that I'll just briefly touch on is our active transportation work. You're probably familiar with, because I give Max the monthly reports, we've been doing some work around bike-friendly communities. We received a $1,000 mini grant in the summer to help kick off and spearhead a community engagement project for the Cape Ann region to find out how people feel about biking, what can we do to make things better in their community so that all residents have a safe, easy way to not only engage in this for physical activity, but also to get to school, to use this as a way to get to jobs, employment. And as we saw during the pandemic, people need to get out. They need exercise. They need to enjoy our open spaces. So we've done a lot of work around just virtual community engagement. We held 4 different community forums, one in each of our Cape Ann towns and city. We had members of the public, also some municipal staff and folks that sat on municipal committees that participated. So we had a good mix of people and ages. We have launched a survey as well, and if you have not taken it yet, please do so. The survey asks, questions for people on their biking habits or, why they don't bike. There's a lot of people who have kind of told me, hey, I like to bike. I will not bike up here because the roads are not safe. So we're really trying to draw out what it is that we can do to make things better. So our survey also includes a map component, so people can actually go on and draw out routes that they currently ride, where they need to go via bike, where we see barriers, and where we'd like to have some connection. So it's been a really kind of exciting thing that we've been doing, a lot of positive response from the public, and there's a lot of momentum for this in the region. I will say we had a number of pieces come out in the press over the fall. My inbox was flooded with people who were just so excited that we're starting to have these conversations. So that's been some great work there. The other topic that we also have been working on, as you may know, is our age-friendly communities work. And under that umbrella, before I talk about our Cape Ann Seniors on the Go project, One of the things that's come up a lot for me in this and falls under my age-friendly work is how are we going to keep people physically active this winter? We know that we're asking people to, stay home and stay, just kind of avoid indoor spaces. So I've been thinking, what can we do as promoting physical activity? So I did create a proposal, which I reached out to our Cape Ann Library directors to see if they would be interested in partnering on a snowshoe pilot project.
Oh, wow.
And this would be setting up a snowshoe lending library, a great way for our libraries to get involved and promote health and physical activity, and also engage with the communities during this time. And there was some initial interest from the Gloucester Library. I haven't heard back from them though, so I'm still kind of reaching out again and again to see. And the Manchester Library, their library board of trustees, they're very interested and they want to go forward. So that's another little kind of project that I'm working on. And this is something that would be available for people of all ages to get out, enjoy nature, the many trails that we have available on Cape Ann. And I think we all could use some fresh air and physical activity this winter for sure.
Can I ask you, will you
Yeah.
also make the snow? So
Yeah, I know.
'cause the first weekend when it snowed, we went snowshoeing.
Great.
It was wonderful. And then of course, by the next weekend,
Right.
it
Yeah.
was nice and mush. And so
I know. So when I brought this up like a while ago, at first because the Department of Public Health, who Mass in Motion reports to, they had been asking us, what are you all doing about physical activity if you have ideas? And I said, well, I'm going to try to throw out, the snowshoe idea. And I said, I think it would be great for our region. We have such an abundance of great nature trails. It's something positive, something people can do, as a family or just individually. And it's, basically it's free. We're renting it from the library. So for our, residents, it would be free. And at first they were like, huh. And then my Mass in Motion liaison from DPH a week later contacts me and she's like, I was in a meeting and they were talking about this exact same thing. And I said, see, I'm not crazy. So I hope that we can get it going in Gloucester. So I'm going to continue to work on that with our library friends.
May I ask you, please, how many pairs do you have?
So we would be ordering them and it can be however few or many as, the libraries would want. So right now we're working on funding. So I know Manchester would be able to pay for some, and they would be looking for us to, through Mass in Motion work, match some. So the other age-friendly,
snow.
oh, sorry.
Who's going to make the snow?
I know, that's the other thing. I get this going and then there's no snow. And I'm someone that doesn't really enjoy snow so much. So it's kind of it's funny that I'm like praying for snow so we can get this going. My family thinks I'm crazy. They're like,
Jennifer, one last question.
Outside though.
Would you allow them to be taken out of town? So if people were going skiing and somebody wanted to snowshoe instead, could they take them out of town?
I mean, I see this as the same as you're taking a library book out. So
Good.
This is really just a way for the libraries to expand upon their lending library of things.
Thank you.
Is what it would be, sure. And I will point out too that the state of Vermont, which has a program somewhat similar to Mass in Motion, they have this as a statewide initiative with with their public health and the libraries throughout the state of Vermont. So the other huge news is our work with the Cape Ann Seniors on the Go project. And this year, we were awarded over $340,000 from the Massachusetts Community Health and Healthy Aging Fund. And that work is for 5 years. It will fund the transportation that we've been doing for 2 years. and the 5 years of program coordination and outreach. And so that work is still ongoing. And we also received $20,000 from Addison Gilbert and Beverly Hospital as well to support this work. So that was really great that they came to us because they loved and believed in the program and wanted to support that work during the pandemic. Now, as we all know, a bus with older adults and, our trips are group and we're dealing with COVID. So this has been another big challenge for us to navigate, but we also know that people still need access to food and they also need access to get out and exercise. And I will say that over the late spring and through the summer and fall, we actually had our highest ridership numbers to date. So we have more than doubled what we were doing pre-pandemic in terms of trips. And I think the other thing, we've been able to keep, small groups of people going on the bus. CADA has been a wonderful partner, and people that took part in our Tuesday walking at the Boulevard, that became like its own little support. People that went regularly really looked forward to it, depended on it. And I think, this was good for people to be able to have something that they looked forward to. With this winter, we have scaled back. So we're really just focusing on trips for food access, which we had been doing, in the fall, the grocery store runs, the open door, and then also Fisherman's Wharf. People really love that addition to our schedule this summer, going there. Rose Lee is still working with me. She obviously is not able to do the face-to-face, outreach like as much as she had been doing before, but she's still been able to keep in touch and does go on the bus now and then. And she's been doing phone calls to our riders, keeping them up to date as well. And one of the nice things with the funding that we've received is we're now able to offer this service to all Gloucester residents that are 65 and older. So when we started this work, we really honed in on focusing on our folks that lived in the Gloucester housing buildings. And now with this additional funding, we're able to offer this to any Gloucester resident that's 65 and older. So that's huge. We know that there are people that live in their own homes outside of our housing friends, that they also have transportation needs. They also need help going to the grocery store. And we hope that they will start using and taking advantage of it as well. Let's see. The other thing I will mention too, because our work with the bus does focus on physical activity, we're not able to bring people to the senior center to do in-person classes and things like that this winter. Rosalie and I have been working on putting together some exercise at home resources. So we have a booklet that will be distributed along with some other information as well. I know that the Council on Aging for Gloucester and our whole region has been working with Senior Care on a virtual senior center, which will have some programs and resources as well. So we'll be helping to link people with that. And our bus continues to do work as a resource within the community. This summer, you may recall, we partnered with Senior Care, the Rose Baker Center, Cape Ann Farmers Market, and we did produce distributions in August. So through our advocacy, we were able to promote this with our folks that live in the housing buildings, and we had 34 people sign up to get the 2 distributions. So that was over 436 pounds of fresh produce that the folks that Rosalie and I focus on, were able to get. And that was huge because that took the place of the farmers market vouchers that had typically gone out in the summer. You may remember those. And this was really the first time that people had said, hey, let's focus in on some of our other priority populations here. So that was great. We were glad to see that. The last good news that I will share that we just found out this week, I had partnered with Kelly Highland, our public health nurse, on a grant for that we applied to for Addison Gilbert and Beverly Hospital's Community Collaborative Grant. And that was focusing on the digital divide. So we're really trying to help our older adults in Gloucester specifically who don't have access to technology, especially during this pandemic. So for Kelly's part, she was focusing on making technology devices available to our Gloucester nursing homes. And for my part, I am focusing on making the technology available to the Rose Baker Center and also our older adult housing units through Gloucester Housing. And these devices for the work that I'm doing will be, again, another lending library, and people will be able to use it so that way they can order groceries online, they can participate in virtual fitness programming, they can communicate with family, friends. Just during this time where people are so isolated, I felt it was really a need that we have. And I also learned that within our older adult housing, over 50% of them do not have access to technology. And so for anybody that has food assistance benefits, they're not able to order their groceries online, even though Massachusetts participates in the USDA pilot program, which allows those who have SNAP to order from Amazon or Walmart. These folks can't do that because they don't have technology access, so they're forced to go out to the grocery store. So we're hoping that these small things that we're doing will be of benefit and will start, leading to better things. So
Jennifer,
yeah.
Can I interrupt just for a
Sure.
second? So when you say access to technology, is it the individual device that they need, or is it Wi-Fi access?
It's both. And then also along with that would be just the education and knowledge of how to use the device. How do you go online and order, groceries through Peapod to have it delivered? And we're really focusing efforts to try to help these folks, especially this winter and probably into the spring, where we're trying to keep them home as much as possible, a lot of our older adults. So so I think that's everything, and tried to go fast because I know you guys have a busy agenda. But if you have questions, please let me know, and always feel free to reach out on any of my projects, or if you have thoughts or ideas, and hopefully we can get some snow.
Yeah. Jennifer, I just want to say thank you. It sounds like you're doing wonderful work for seniors, and it's just so important during COVID.
Yeah, thank you.
Just the idea to how people are going to get outside. I personally, I struggle with it, but
I know. You have to, you have to force yourself out there. For sure. But we have the Mass in Motion grant through June 30th. So the Department of Public Health, we're awaiting at any day. They were supposed to release it in the fall. They're a little busy, obviously, these days, but we will be looking forward to them releasing a new grant application, which would be for another 3 years. We'll have to apply and see if, if they will take us on. So we'll see.
One other bit, Jennifer, I'd want to commend you on your narrative that you put through. You're in detail and I read it.
Oh, thank you.
It's very useful. Thank you.
Thank you. Thanks so much, everyone.
Thank
Have
you.
a good night.
you too.
Thank you very much,
Thank you.
Jennifer.
Yeah.
I just want to recognize the mayor joined our meeting. Thank you for coming, Mayor. Okay, we shall move on to the next item on the agenda, which is old business and discussion of the recent surge in COVID-19 cases.
This is
Karen,
getting to be very old business.
Getting old.
Yeah.
Continuing old business.
Yeah,
Karen, would you like me to go over the material you gave me earlier today?
Yeah.
Okay.
Well, why don't you talk about the vaccination effort and I can give the update if you want.
That'll be fine. Well,
Thank
as you all have heard, we did get our some of our vaccine in this past week, particularly for our first responders. We're going to be vaccinating our first responders here in Gloucester, as well as our surrounding communities of Essex, Rockport, Manchester, and Ipswich. The criteria was that we had to have 200 people to be able to vaccinate. We do not have 200 first responders in Gloucester, so we reached out to our neighboring towns and were able to accommodate both getting the vaccine locally and helping out with that population as well. The people that we're going to be vaccinating will be our first responders, which will be our fire, police, EMS, and harbor masters, as well as 911 dispatch employees, if there are any. Most of the 911 dispatch are fire or police already. So this would not be like in Essex where they have the regional dispatch. They're going to be taking care of their own in that area. We're also going to be bringing in some of our school nurses who will be working the clinics. And I think there are only 4 or 5 that are not going to be able to work the clinics, and they have been elevated to a higher level as of today. And we will be taking care of them next week as well. We did our first round today where we did 30 of our vaccinators and our command staff. It went very well. We were able to run through our existing plan and make some tweaks as to regarding how we need to make it work a little bit smoother. Fortunately, the state's computer system was up this afternoon, and we were able to try it out, and we are going to attempt to use it tomorrow. Tomorrow will be a much smaller clinic. We've got 10 people that are coming through tomorrow. So we'll ask them to register online and take a look and see whether or not that system is working. Fortunately, it goes live for everybody on Monday, and by a pure stroke of luck, we decided we wouldn't do our first clinic until Tuesday because, you know, those things that are brand new tend to crash. So if we let them crash on Monday, by Tuesday, we should be fine. And it is a very specific group. We're taking the first one slow. We're doing 500 people. We are doing 5 clinics. So our put through will be 100 a day. We'll have 6 vaccinators, and we'll have 4-hour clinics. So we wanted to be able to maintain social distancing because people have to be observed for either 15 minutes or a half hour, depending on their personal issues in terms of medical stuff. And we did not want to crowd people in. So we were very careful about making sure that we had both the capability of social distancing as well as a reasonable put through. We're doing this at the Rose Baker Center next week. It's the right size for the groups that we're doing. Fortunately, with the Prep Mod system that the state has given us, people can self-register and be given time slots. So we have a good amount of control. Hopefully it works. If not, we'll go to Plan B, and we'll be working there. We're not expecting, our indicators right now is that we will give out all 500 shots, and we have someone who is a nurse who's very qualified that's going to be doing our clinical work in terms of watching the doses and making sure that we don't have any extra that we need to either give away or throw away. We certainly don't want to throw anything away. And we will be reaching out to the people in the different phases in order of priority. So if we, for example, have any hospital people or people doing front-facing COVID care who could not get their shots at the hospital for whatever reason, we would be able to take them on a standby basis if one of our people was to have to cancel at the last minute or didn't show up for their shot. We'll go down to that and reach out to our long-term care facilities and see if any of their staff is in a similar situation. And of course, our congregate care setting. We're not really in a position of, we feel that we'll be able to fill anything that we have right now for the shots that we have. So we're fairly confident that this is going well. The kind of cooperation that we've had from all of our partners, both local and out of town, have been very, very positive. Again, today went well. We worked our plan and we identified what we needed to change, and we made those changes on the fly, and they worked out pretty well. So we're looking forward to tomorrow. There's always unexpected situations that come up, right, Karen?
Karen, let's not lose you here.
This whole day,
It's
been an unexpected situation, one right after the other.
Yeah, pretty much. But we're okay. We're okay. You know, I'm still
You be kind to
still got my
Karen.
mug. I'm good. And we'll be back at it tomorrow morning, bright and early at 8 o'clock. So that's pretty much what we're doing right now. What we're finding with the state is that it is a moving target, and it is rapidly changing, and we need to check with them all the time. As far as setting up additional clinics, we're going to get for next week first, and then by then the state will have some additional information. We'll see how PrepMod works, and what the state has in mind for some of the larger clinics, especially our front-facing medical professionals that are not necessarily COVID front-facing, like our doctors and our therapists and our dentists, so to speak. So we need to get some clarification from the state as to how they see us moving forward with that situation, especially with identification and licensure, if they want to keep track of that. So we're waiting for some more indicators on that, and we'll keep you all informed as we move forward. Karen, anything else you want to add?
No, I just want to thank you very much, Carol, for stepping in yet again to really help with this effort today and the coordination. It's been extraordinary, and we've got great teammates in the city, Chief Smith and his team, Rob Rivas, our new emergency manager. Jenna Newbegin from our department has stepped up into the finance chief role. So we've got all the positions filled. Having said that, we are in a pandemic, and this operation is not immune from people having COVID scares and exposures and close contacts. So that has thrown us as well. We're trying to create a 2-deep system at least, and then several backup for our vaccinators, so that we do not have to interrupt any of our clinics next week or in the coming weeks because of COVID. But that's where we are. So, we are, yeah.
So Karen, a naive question out of ignorance. Are the hospitals, for instance, AGH, are they running a separate program dealing with their people? Are the elder care facilities around, are they being dealt with separately? So a little bit of background about that.
Yeah, we can't really tell you a whole lot, partially because we're all in our silos and we're getting our information from our agencies, but we'll quite literally be on a call with DPH, and we'll be having DESE sending information to about programs they might be offering in the school. So it's rolling out quickly. I think the state's main objective is to just very quickly move this vaccine to anyone who puts their hand up to say, we're capable of distributing it. So that's great in a way that we'll have more people on deck, but from a planning and an equity issue, it's not always so great. We're finding that sometimes the queue, where people aren't following those priorities as tightly as we would. But we're just kind of staying in our lane of what the Department of Public Health is letting us do and what we can keep up with, which at the moment is the clinics Carol described. But we definitely have partners. The Gloucester Family Health Center has been doing some work with our congregate living shelters. I don't really know what their program is, who they can do, who they can't, how theirs works. So we're trying very hard to get, to communicate amongst ourselves, but frankly, we're all pretty busy, and that's even like another layer of coordination that just hasn't really happened yet. But certainly CVS, the private pharmacies are providing it, the hospital is doing it. And Senior Care this morning on our group call said that they were on a call and they're going to be potentially getting some vaccine, it sounded like, to move out. So we're trying to kind of get a handle on it.
So I presume the overarching control or information clearance is through the state, the DPH.
Yeah.
And are you confident that they are plugged into all the players? I mean, is anyone likely to fall through the cracks because of all these separate organizations?
Probably, or maybe more worrisome is people jumping the queue, if you like. So organizations, because somebody has some doses and they work in a certain sector, they're going to start delivering it prior to the sort of state's prescribed. But I really don't know there's a whole lot we can do about that. And the categories, everybody needs it. And we certainly have our high risk, most vulnerable categories, but I think they're really focused on moving it out to anyone who can assist with that. So hopefully there's someone at the state is really coordinating or trying to know who's doing what. But the hospitals
Gloucester,
are.
I mean, given that we're most likely in Gloucester, you are obviously confident that there is no group that ought to be being vaccinated now?
Oh, no, we won't miss them. No,
Right.
no, between our weekly calls, our very tight networks, and people are very vocal and letting us know that they deserve to be vaccinated. They want to be vaccinated. They need to be vaccinated.
Right.
So I really can't see that happening, but I think it's a good point for our vaccination team to kind of constantly be scanning. I mean, at this point, we're just looking at these first responder groups.
Yeah.
So, for example, one group that did fall through was our harbor master, because they are first responders, but they don't sit under police or fire, which were specifically called out. So that's something the mayor's office helped push that up, and we've been able to clarify. But I think people will let us know, or will notice, most folks. And, but I think these will be the challenges when we get into the wider populations around how to make sure that people are comfortable coming to our clinics, people can access our clinics, people can access the technology needed to register for an appointment at the clinic. People can get a ride to the clinic. These are all the things that we will definitely be concerned about, whether it's whole groups that fall through the crack or certain folks in the community that will really have to make sure have access. It is not going to be easy. There's a lot to do. A 2-dose vaccination for an entire population is a pretty heavy lift.
Yeah.
Yeah.
Following up on that, because so many people have been asking, how will people know, let's say, the over 75 group, which I'm sure is a huge group in Gloucester, how will they be informed that it's their turn? Well, because not everybody reads the paper or is on social media.
Yeah, we will work with the communication folks in the mayor's office. Our communication, the state will hopefully be helping with the messaging as well. We'll have to pursue all avenues. Hopefully, it will be a little bit more targeted, because within that age group, we have so many subgroups. We have our housing, folks in our senior housing. So that will assist us, but we will be looking to all of our partners that work with seniors to make sure that we're finding everyone that needs it, wants it, I think when we know more, you will and the public will. I think what's been hard is that we absolutely have no indication of who will be next after this week, like what the state will say to us next week that we can do the following week. So there is plenty of vaccine in the state, and they want us to keep ordering through this portal each week. So we kind of think, but we've also been given extremely strict instructions at this point. We cannot hold clinics for anything but first responders. So, you know, I think it's going to evolve pretty much daily for many, many weeks to come. And as we've done all the way along the line, we'll work with that sort of COVID response group that talks with all our partner agencies. You know, Peggy's here tonight. We'll rely very heavily on Facebook, on the mayor's communication tools, and just, you know, if we can, we'll go to sites where there are, especially for senior housing. I think our plan always was to try to move the vaccine to those places versus moving the seniors. But again, we don't know the rules. At this point, the state is not allowing us to move the vaccine. Really, you know, we can't move it around. We can't take a bunch and send it to Essex to do their senior housing. So there's a lot of challenges and a lot of rules, and the rules are changing pretty regularly.
So when you get it, is it still on dry ice or has it already been thawed?
No, it's frozen, stays frozen. It stays frozen until an hour before the clinic. We take it down, thaw it on site. Some communities are thawing it ahead once it's, but apparently it's less stable and once it's thawed or partially thawed. So Kelly really wanted to not do that, to just keep it frozen.
And it will be an online system, you think? I mean, even in the broader community?
I'm sorry, Claudia, what's that question?
I was asking if it will be an online system, you know,
No.
a point, which is wonderful because when you saw like what happened in Florida or other places where they just announce it and then like, you know, 500 seniors standing.
They're lining up.
Yeah.
I mean, that's how awful.
It is awful. I can't say that there's any more of a communicated sort of clear, coordinated federal or even state vaccine rollout plan. We really don't have that. And I think communities are figuring it out as we go. The scheduling system is great, but I think it also has some challenges. It's first come, first serve. So, you know, it may cause it to crash. It may cause people who, you know, it may make it difficult for our first responders next week to all get into the clinics at the times they can, because there's only so many set spots. And then, of course, the issue of access. If seniors or people don't have internet or laptops, or they're not comfortable with the technology, it's going to be a challenge. And I don't know what the plan is for that yet. I imagine we'll probably have to rely more on backup methods and assisting people with the registration process. But we're hoping that the state will do some of that planning and have, but I don't know, you know, probably not. Probably Carol and I and the team will be figuring it out as we go.
Karen or Carol, the nuts and bolts question. You know, the senior center has been closed to the public. Are you satisfied, or would you want to go and see about signage for the markings on the floors and things that we find all over the city that might not be present in the senior center? That's something I would handle for you if you wanted to do that.
Well, thank you, Fred. I think for the clinics that we're going to be doing next week with our first responders, we've given enough time in between our appointments that I think our audience are well educated in terms of COVID as being first responders. We'll have enough people there to remind them that they have to stay so many feet apart.
Yeah.
And we've actually spaced out our tables and our waiting area chairs that are 6 feet apart, so that we should be okay for next week.
Okay.
But I will tell you that signage will be important if we start getting into our larger, you know, hundreds and hundreds
Yeah.
of people type of thing. Would be
Well-
like, and we may not be looking at doing it at, obviously something like that, we'd probably be looking at a much larger venue because we'd need the space
Okay,
to be able to let people sit for 15 minutes to a half an hour, depending on what their personal issues are. So that would be something we'd be looking at down the line, but I think we're okay for next week.
Fine.
And thank you, I appreciate that.
okay. Well, change your mind, let me know, please.
I will.
Well, it's very exciting to hear that.
Oh, boy.
This is really moving forward, because it sounds like things are once again skyrocketing in the city with COVID, and not just in this, not here, but everywhere.
Mhm.
And to hear that there's vaccine on the way and that the state, is wanting it to come, is really wonderful to hear.
Well, I got my shot today. My arm does not hurt.
Uh-huh.
I feel fine. It was actually less painful than the senior flu shot, I can tell you. So I'll let you know if anything comes up. But it was painless and relatively quick. So
Great.
Okay, anything else on COVID?
Well, I just would be interested in knowing, kind of where we are.
Yeah,
the numbers.
I prepared just a quick update, that same document we worked through, just to kind of go over things, but, and I won't go through all of it. You guys can look at it. Some of you heard it this morning. But yeah, our cases continue to rise here in the city. We have about 115 active cases as of last night. We have 5 in the hospital, and only 1 death in the last few weeks. So we did have an increase of 4 deaths in the last couple of weeks, but 3 of them were actually coding things. They were people we didn't even know had COVID. So they've died sometime in the previous months, and after they died, it was then found out that they had COVID as well, and then they get coded that way. So, so we're at 31 deaths total. But again, we're not seeing, like we did in the spring, really sick people with calling for ambulances, those kinds of things. The hospital is starting to see more admissions, both locally and then around us. Our region right now is a concern. The ICU beds and our region, Region 3, which includes Lawrence and Lowell, is at 97% capacity. So that's very high, and that's the highest it's been. We're watching that really closely. There are field hospitals that can flex up further, but the staff aren't there. So it's going to be more of a staffing constraint, I think. And I know that the state and the governor's office, the mayor's office, all of us, we're watching that capacity of the hospitals very, very closely, the occupancy. So that did jump a bit in this past week, and that is kind of concerning. The other thing that's changing is the age of the hospitalization. So we're starting to see that shift to the older population getting admitted into the hospital. So again, very concerning. Our long-term care facilities are doing pretty well still. We did have a few cases yesterday, I think 3 in one day, mainly staff. So that was a lot more than we've seen in the past months. So again, watching that very closely. The wastewater, as I think you know, was over 1 million particles last week, which was scary to see. Our highest level before that was, in the 700s. So don't know, we'll know this week whether we're going to see that continue to rise. I think basically it reaffirms the picture that there is widespread virus in our community. And we're certainly seeing widespread transmission in virtually all environments. Again, household contact is the main source of new cases and spread, but we're seeing cases cropping up everywhere, lots of contacts, lots and lots of offices, businesses affected by COVID. You kind of can't not be at this point. So that's a challenge for the business community. It's a challenge for all of our agencies, organizations. The city is encouraging offices to stagger, be creative, work from home if people can, make appointments to come in for city business if possible. All of those things we did back in the spring to reduce contact. The schools continue to do very well. They had 8 cases as of Monday, 8 active cases that were known to them between their staff and their students. And they are seeing, I would say, more teachers than students at this point, and none of them related to transmission within the schools. So, from elsewhere. They are reporting that they have sufficient staff to keep operating, and they're doing a great job at this point. They also have the Bionex Now, or whatever it's called, that they can test symptomatic staff and students on site. So that's great. They do a rapid test right on site to assess what's going on. So I think those are kind of the main things I report on. I told you our case numbers yesterday in the state was a big day. Actually, 2 days ago, reported yesterday, almost 6,500 cases, new cases in one day for the state. So that's a huge number too. A lot of big numbers. Our test positivity rate for the state is over 8% now, and for Gloucester, it's just over 6%. So we've seen that climb significantly as well in the past few weeks. I think those are the main things. It's concerning. We are watching these numbers really closely and just kind of expecting that there are cases everywhere. We're now almost 2 weeks post-Christmas, but we still have this sort of holiday period up through New Year's where there was a lot of travel, a lot of activity, a lot of socialization. So we expect we're not quite through it yet.
Is Edison Gilbert still a COVID-free hospital?
Yes, they are still COVID-free, and we'll try to stay that way as long as possible. They are doing okay. They reported today in the call that they're doing okay, but they are getting they are seeing more pressure on their beds, and they're watching it really closely too. Yeah.
Wow.
And the testing, testing is testing. We talked about that last time. There are some more opportunities. The turnaround time is stayed between 2 and 3 days for the state, and we're similar with our team as well. So, at this point, that's pretty good turnaround time.
Thank you. Wow.
Yeah, you're welcome.
May I ask, please,
Take a deep breath.
what is considered quarantine time now, number of days?
It depends. There's no straight answers to anything with COVID.
That's why I asked the question.
If you are determined to be a close contact, so you're not COVID positive and you don't have symptoms, you can get out at day 8, basically. So just keep it simple. You can leave your quarantine at day 8 if you don't have symptoms, if you're willing to monitor, and you test negative. You have to get a test.
Yes.
If you don't do all 3 of those things, then you need to stay in for 14 days. If you're a healthcare worker, it's different. You unless you're symptomatic, it's a different equation. Travel, though, is still 14 days. The state did not alter that. Test or no test. If you travel, test negative, you may get out of quarantine. If not, your 14-day quarantine remains. And then if you are actually diagnosed with COVID, if you're confirmed positive, then you're in that 10-day isolation from the start of symptoms or testing positive. Yeah.
Karen, so 8 days you can get out of quarantine with a negative test, but you can't get that test until what, 5 days? Yeah.
5 days, right. Right. So you wait till day 5 if you have no symptoms and you get tested on day 5, and then you get that negative result on day 8. The morning of day 8, you can go out of quarantine. Yeah.
You have to break quarantine in order to get the test.
You have to what?
Break quarantine in order to get the test.
It's allowed. If you're going for medical treatment, you can leave quarantine. If you're getting essential medical care or pharmaceuticals, if you have to, that's okay. You need to mask up and let people know you're coming. Yeah.
Okay, but I didn't know that. Thank you.
Yeah.
The travel issue is so frustrating because so many people that I've heard who have traveled who have, they did all the right things and got tested before and they filled out the form and they get off the plane and nobody asks them. And they got off the plane in Massachusetts, nobody asked them for anything. So there isn't follow-up to see whether people are really following the protocols.
Yes.
So therefore, you know,
Part of it's on the honor system.
yeah, exactly.
Yeah, and again, I would say compared to other countries, we've had a more relaxed, less rigorous process of containing the virus. I mean, other countries have had aggressive shutdowns for periods of time, and they've done a better job containing the virus, you know, in a shorter time period. Doesn't mean they haven't had to do that 2 or 3 times or come back out, but we don't have you know, any kind of policy like that.
They
My
also have
daughter
more
who lives in
significant
Thailand,
consequences
What's
who
the
was
difference?
home,
if you don't follow the rules.
right. So my daughter who lives in Thailand, to go back, she has to go through a government quarantine hotel for 14 days.
Australia is the same way. Yep.
Different levels, you know, of how much you want to pay, but you have to arrange it with the government before you fly in. You can only fly on certain flights. And then for 14 days, you're in quarantine at
Mhm.
And you have to pay for it in some countries.
Yeah.
What's
yeah.
that?
Mhm.
You have to pay for it.
Oh, yeah, she has to pay for
Oh,
it.
yeah.
Yeah, she has to pay.
Yes, and now with genome tracing, they've identified the fact that people even sitting 4 seats away on airplanes are becoming infected on the planes. But the recirculation system simply isn't functioning the way it's been advertised.
Yeah.
Really, wow.
Any other comments or questions?
No.
Why don't we move on then to discuss the extension of the eviction moratorium?
Hi there, folks. We're continuing this discussion from the board's October 15th meeting. And really this whole journey started back in April of 2020 in the early days of the pandemic, when the governor's office had put forward a moratorium on evictions. But the concern that was discussed, and I also want to thank Lori Fonseca and Peggy Haggerty-Steck for joining us. It was brought to our attention that one of the concerns with that moratorium was that it did not include anybody who was already in the eviction process, so that they were still in danger of losing housing during the pandemic. So the board and the mayor's office together put forward their own moratorium. It's been in place since April 10th. I want to say April 10th. And, but the governor's order ended in October 17th. And so prior to that, the board just wanted to decide whether or not they were going to continue with their moratorium or do what the governor had done, which is to basically defer off to the CDC's moratorium, which has several different requirements associated with it. And I'll just read off what I've got here. In general, it requires a written declaration to the landlord by the occupant that they are not going to be able to pay their rent on any particular level. Let's see, the other note is they can go through the process, so that the landlord can actually go through an eviction process, but they can't actually evict the person or enact the eviction until the CDC order has expired. Now, as a note, and the reason why we're having this conversation today is that the CDC's order is ending on January 31st this month. So, and you also have to meet, like I said, certain criteria of income and vulnerability. It's very generous in terms of income. So you have to make less than $99,000 as an individual or $198,000 as a household. You have to prove that you're going to be homeless otherwise. But it doesn't prevent a landlord from seeking rent once the moratorium is lifted, but neither does ours. So
I'm sorry, the last sentence again?
Oh, sure. It doesn't prevent the landlord, once any moratorium is lifted, it doesn't prevent the landlord from seeking back rent. Of the occupants with the CDC rule, and Peggy or Lori, correct me if I'm wrong, they have to I think prove that they're unable to make any contribution if they can't, or have to show that they've made some honest, genuine effort to make a rent payment of any substance. So with the CDC's order ending on the 31st, the question is now whether or not the board wants to continue on with the moratorium, and the mayor's office want to continue on with the moratorium that you have until the next month, and do like a monthly review to see if they want to just keep going with it, or just join the CDC's moratorium. Well, see what the CDC is going to do after that, especially with the change in administrations. Who knows? But I've asked Lori in particular, and Peggy obviously as well, if you can give us kind of a 30,000-foot view of what's going on, not only in the community, but on the legislative front.
I can just give you, I'll talk a little bit just about what we're seeing in terms of people's need for assistance, and Laurie can talk about, Laurie's our housing attorney and has done work for many years trying to avoid eviction, mediate situations between tenants and landlords to help people stabilize housing. So at Action, just in terms of demand, there are lots of people in need of rental assistance to try to avoid housing loss. The eviction moratorium has been really helpful to at least have some level of safety net, but just to give you a sense of the demand in Gloucester alone, we received $100,000 in community preservation funds to help people a number of months ago, and we're down to $1,000 now. So the bulk of it has been distributed to people, or is encumbered for people for the plan of rent payments that they have. And we have a second request into the Community Preservation Committee. And the federal government just put through in the COVID bill a significant amount of money for rental assistance and utility assistance. But I think similar to sort of how Karen's talking about the vaccine, the flow of how that's going to work is not really clear yet. And it's a, there's more information to come. There's just been, like informational webinars this week, so we don't know, but there's a clear need for rental assistance in order to help people avoid losing their housing. And Laurie can talk more specifically about individual cases and what she's seeing on the ground in terms of court activity.
Yeah, Karen's numbers and narrative, it was the perfect introduction to this topic, because the focus across the board nationally is with safety, and housing stabilization, which go hand in hand. So we see the numbers going up and up. We see the numbers with COVID, but we see the numbers with rental assistance and demands for also assistance with mortgages. The numbers in terms of executions is really the end point of eviction. Those numbers have been very small because statewide, because of the moratorium, because of the statewide moratoria or the CDC moratorium. So, and that is through January 31. However, the CDC is very narrow. It is only for non-payment of rent cases. So if there's an eviction that's pending and it is for no cause, landlords don't actually need a cause to evict, the CDC does not protect them. And as you might imagine, people maybe won't bring any other kind of a case, but just not something other than a non-payment case. They won't be protected under the CDC moratorium now or in the future unless those terms change. I think the other thing that's important to note, just in Gloucester, the eviction numbers are not high compared to the state, and even compared along the North Shore. Pre and post moratorium numbers for Gloucester, both housing court and district court, are 24 cases. That's pretty good. And so in talking with landlords, both smaller landlords who own 3 units or less, and large landlords who own 100 plus units, they tell us that the resources available in Cape Ann have made all of the difference. And I think, actions, Peggy's talking a little bit more about accessing more resources and keeping that flow going has made all of the difference, because tenants need to make payments to the owners. The owners need these payments to be able to run their business. So it all goes together. So in terms of continuing the local ordinance with Gloucester, wholeheartedly agree with it. Whether it's in step with the CDC date of January 31st and then continue it to February, that's certainly better than not having one. I would advocate for looking at the longer view of this, as Karen was talking about the flow of the pandemic. It really doesn't shift that quickly in a 30-day span. I think we're going to need that protection for the next few months to see how things go, along with continuing the resources and getting the word out there about the resources. Action has financial resources, has referrals for all kinds of resources, budgeting, behavioral health, all of this pool of resources, I think, is what's really important, along with having the ordinance. And I think that's where Gloucester does a great job. Some of the municipalities in the state have some of the things, but not all of the things. They might have financial assistance, but maybe it's just for tenants and not for homeowners. They might have the statewide system the statewide RAF program that they're referring people to. Gloucester has a very holistic pool of resources, thanks to many of you here. So I don't know if you have more questions about numbers. We have had a few cases where the landlord did move to levy, that is to initiate that final eviction step. One of them that I was involved in, I found out actually after. We did help him to move along to a place that actually was better suited to him. There will be a few situations, very rare, but some situations where remaining in that unit is not a good idea and not safe. And so, again, resources available to help that person move to someplace else and be somewhere else where they're not out in the community exposing themselves or just someone else with COVID. I think that we want to recognize that there will be a few instances like that. So, do you have any questions?
So
concerns?
yeah, it sounds like the moratoria, however defined, at least as they apply to Gloucester, are working well, but largely because of the resources that have been made available to ameliorate the demands for payment, basically. And so is that not the crux of the matter? How do we stand with regard refilling those coffers to keep that going? Is that?
Yeah, I'd say it's an important pairing because, like Laurie was mentioning, some of our landlords aren't, large corporate entities. They're small mom and pop folks that need to make their mortgage or they'll end up without housing as well. So it's really important to have that financial assistance to help the tenants stay on track, as well as some of these property owners. And so, like I mentioned, we had community preservation dollars from the city, which was excellent. And we had $100,000, but now that's down to $1,000 for what's left. And we have a request in, but we won't find out until maybe later this month or February. So that was also part of why we were thinking, well, having a couple of months added to the eviction moratorium would be helpful because there's this gap period. We also have been very actively fundraising. So altogether for Gloucester and the other 4 communities we serve through municipal requests as well as foundation requests, we've raised over $600,000 to help people with rental and mortgage assistance, COVID related for most of it. But it's all getting accessed quite rapidly. Ipswich as well, we got $100,000 from Ipswich several months after Gloucester, and that's down to maybe $15,000 left. I mean, there's a huge need out there. So we do need to have both things in order for it to work, because if you have a moratorium for this long a period of time, you know, there are homeowners that are negatively impacted as well. It's sort of like remembering that it's not always, you know, sort of the big bad landlord versus, you know, some of these landlords are no different than the tenants that are living in the units.
Well, Peggy, that would be my point, in that the person that seems to be getting the softest lift here is the bank.
I know that people basically, you know, and Laurie, correct me if I'm wrong, but I know that banks have allowed folks to like tack on mortgage payments at the end of the life of the mortgage, but it's still money owed. And just like folks who, you know, are under this moratorium, all that money still has to be paid at some point. Like it all comes to, you know, the harsh, you know, endpoint where all of a sudden there's thousands and thousands of dollars owed. So without this assistance to help people, and as Laurie mentioned, we help people with not just the rental assistance, we help people with heating and food and job readiness, we try to comprehensively look at what's going on. But the reality is, in a pandemic, it's through no fault of anyone's that, you know, businesses have to be closed, so jobs aren't available. It's this ripple effect throughout the community, which I'm sure you're all well aware of. So we're just trying to provide enough of a safety net to keep people afloat until we get to the other side of this. And that's really been what's working since March. And like Laurie had mentioned, I mean, we've been able to prevent a lot of these very scary situations. There's, you know, the public health impact of people being without housing or being stacked up in housing. And then there's also the issue of homelessness, and there's no capacity and shelter. There's so many layers to this problem. It's overwhelming.
Well, I'm not hearing an answer for the landlord and how they're supposed to survive.
Well, yeah, I mean, they survive through getting either mortgage assistance or for themselves or rental assistance from their tenant. That's how they're, you know, by providing the tenant with the rental assistance, we pay the landlord directly. So the money, you know, we have staff who work with people, but at Action, we process it, we do all the eligibility paperwork, et cetera, and then we pay the landlord directly. So that's the way that's the way the landlords are getting assisted by receiving the payment from the tenants. But you're right, on the banking end, there's not as much relief as there could be, for sure.
I mean, really, what the banks could do simply is extend the term of the loan. So instead of a 30-year mortgage is now out going to be 33 years.
Yeah, some are, but it's still money that has to get made up. They're not, no one's waiving anything. Yeah, no one's forgiving anything. Yeah.
You can be 70 and get a 30-year mortgage.
Mm-hmm.
You know, and so the attention, now, if you're lucky, you'll live to be 100, but so you could extend, a bank could extend the loan.
I know some are, right, Laurie? I mean, I know I've heard that.
They are. There's what they call actually covered mortgages that are FHA backed, and they are. I mean, I was in court this week. There are half a dozen post foreclosure cases, right? So once there's a foreclosure, if the owner, the former owner, is still living there, the bank just can't move them out. They actually have to go through the eviction process for a former owner. Oh, yeah. And in court this week, these banks, one of them actually was in Michigan, was hands off and said, we're not doing anything with this case. The banks, and that's post, that's once someone this is from a 2019 case. They're not doing anything about it. The same thing with folks that have these these notes, nothing's being done with them. And what's going to happen at the end, I think we want to make the distinction. Are they a mortgagor who has also tenants?
Yep.
Because those tenants we can assist, that will in turn help that mortgagor. And then there may be some of them who can get assistance directly. In fact, we've talked a little bit about some cases where the tenant wasn't eligible for some reason, but the owner of the property that was renting it out could be eligible.
Yeah.
So, there is quite a bit of creativity there, because the focus really is to kind of lift up this whole tide, to lift up the owners and the residents. Yes, and let's also be, I want to remember and be hopeful of a new administration that already has been talking about more protections that are we are hearing pretty radically different.
Lori,
So-
see, that banker from Michigan doesn't surprise me, because I suspect he drove through Detroit to see what
Yeah, I'm
happened
not
when,
sure.
when foreclosures were unchecked.
Well, I'm not sure where this person was from. I was encouraged by the fact that they were not going forward in any
Yeah,
shape or
Good.
form.
I'm encouraged too.
Right, by that. So I really think the message, I think that this moratorium locally, your Gloucester moratorium, is a very good message to everyone that no one should be becoming homeless.
Yes.
And that there are resources. What is going on? How can we help solve the underlying basis for the instability there, financially, employment wise, and I think it is the communities, really the biggest successes are coming from the communities where they can look at what's going on. There is, Karen talked a lot about the other communities and how we're working together. So there are 6 other North Shore communities who have the same ordinance that you have, the same moratorium. In fact, now we're thinking we want to talk with some of the other buffers around Gloucester. Beverly has it, Danvers, Salem, Lynn. There's
So can I-
6. Peabody.
So,
Peabody.
so I'm assuming, I guess we're all assuming that this big uptick is because of COVID and businesses closing and people losing their jobs, that the rates are so much higher, and so just sort of going full circle to the vaccine coming and a little bit more hopefulness that as people start to get vaccinated, businesses might start opening up, and that within some time frame, things are going to get better. So what's the sense of, extending the moratorium for how long? What would be a recommendation? Is it kind of indefinite or month to month? Like Max, you were saying, evaluate it month to month, or?
So just by way of information, the order currently states that it's in place until the board considers the pandemic crisis at an end, essentially.
Oh.
That's no longer an issue. So it
well,
can
there
stay
you
in
go.
line. So for the board this evening, if they choose to just keep it in place, that's all you have to do is just say, we're going to keep it in place, and that's it. And then you can bring it up at any time. The only thing you would have to vote on is if you were going to make any changes or rescind it.
So inactivity is the way to go.
What's that, Rich?
No action.
Yeah. It seems to me, I certainly am in favor of keeping it in place.
Peggy or Lori, do either one of you think that would somehow either encourage or discourage eviction, the intention, if we took no action?
Yeah, Peg, yeah.
Well, yeah, I think however you want to word it, I think it gives stability for people to know that that is still in place, and that, we can still work collaboratively with landlords and tenants to get that assistance. We do know that there is more funding coming for rental assistance. So they're at the federal level, and how that shakes out, we'll see. And that we also have another request into the Community Preservation Committee. So I think the funds will be there to pair with the eviction. So it's not like you're leaving landlords, with this burden that they can't meet.
Right. Rich, which makes me think of terms of revisiting this in 6 months.
I think that's reasonable, and sooner if needed.
Yeah.
Yeah. Just to tell a landlord that open-ended, yes, it is, but we would be responsible enough to re-up, if you will, rather than
I
just
agree.
try and forget about it.
Sounds good to me.
Yeah, I agree.
So I don't think we need to take any action except just
Nope,
put it
you're
on
all
the
set
agenda
then.
for 6 months.
Yeah. Okay.
Thank you very much for coming.
Yes.
Thank you all.
Thanks,
for-
Doug.
And
Thank
thank you
you.
for the work you're doing.
Yes,
Really.
indeed.
Yeah,
Good
really.
luck
Thank
on
you.
finding more dollars.
Yeah, yeah.
Yeah.
We're always hustling to get more assistance to people, and COVID, I mean, this has been a whole new frontier. So
Yeah.
thankfully, Gloucester's, I mean, I know you all know this, but as an outside organization, I mean, the city has been phenomenal, and, the coordination and the work together, and we've worked so closely with Karen and the mayor on so many things, and we're just grateful for that. And I feel like, together we've been able to kind of ride this wave, and we'll just keep going, and somehow we patch it together and make it happen. So thank you all too for the support, and for the city staff and leadership too.
Why don't we move on to
Great.
the department updates?
Thank you. Thank you.
Thank you.
Bye, guys.
Thank you.
Yeah, I didn't, I didn't have a lot prepared more than what we've talked about. I think the department is very focused on COVID right now. We've been pushing and pulling people to assist. In fact, some of our inspectors, Marcus, will be helping at the clinics next week as our safety person. So we're really very focused on all things COVID. Max can talk about his team if there's updates there, but they've been fantastic too. Our inspectors are working closely with our nurse contact tracing team. When there's a problem in a business or a restaurant, we kind of work together to deal with it, or to investigate or follow up on complaints. So
Kelly's
I don't.
okay so far?
What's
What's
question?
that?
Kelly's okay so far, at least?
Yes. Kelly's doing great as our vaccine coordinator. She's heading up that side of things. So, yeah.
I thought the report covered most of what we need to be aware of in any case.
Yeah.
So
Yeah.
unless there's any specific questions about the report or what it contained or didn't contain, why don't we move on?
Yep.
Concerns of the board.
If I'm asked, as I have been, about how can I be helpful? How can I just let me leave it at that. How can people be helpful? How can I be helpful in a useful way? I've been asked 3 different directions because of involvements that I've had, and so I haven't responded to any of them because I wanted to offer myself perhaps during working hours when other people have to be making a living and things like that. What's the process for volunteering?
Great question. Thank you for bringing it up. We're doing a lot of press and outreach through the mayor's office as well on this. For this initial smaller clinics, because of timing, we're using existing city staff and people that have worked clinics before, or our nurse contact tracers who have been working with us.
Mhm.
So, but we will need volunteers. We will need lots of them for the upcoming broader clinics that will be larger clinics. So what we are encouraging people to do is we're asking them to go to the MRC website, or the MA Responds, and it's on our Facebook, it's on the mayor's. We'll be pushing it out. and we're working really closely with them. The MRC has the ability to take in, Claudia knows she's been an MRC for a lot of years.
And I
Take
just
it-
re-upped my thing today because.
Oh, fantastic. Good, thank you. Yeah, I mean, I think what happened is after H1N1, there wasn't a whole lot of use for MRC. Some communities continued to use them a lot. So we're really trying to get that going again. Well, it's been going, but really utilize that here for the scheduling. So we'll be able to say, we have a clinic, here's the positions we need. And the MRC coordinator for our region will send out an email blast, and then people can respond who are available. We will still have the final say of, picking the volunteers and putting them into roles. But the MRC also will do the credentialing nightly. It combs through credentials to make sure they're up to date. It also does the Cori Sori for us. So it's an excellent tool, and we need it. We can't start, hiring or trying to juggle the schedules for these larger clinics.
So that's one of the ones that appealed to me. That's the one I should respond to?
Yes, please.
Okay.
We'd love to have you in there. Yep.
Yeah.
And in the email that I got this week, they're also saying, if you work at one of these clinics, you can get vaccinated.
Yes.
That's one of the perks. That's what kind of really motivated me, because my Cori was out of date and I keep getting emails for like the last year.
All right.
So that's what.
Well, I have that email as well because I signed up long ago.
Yeah.
Okay,
So,
Fantastic.
that
Yep.
is a big perk to be
that's
able.
the one I'll use. I mean, that's helpful. Thank you.
Yeah, so I'm glad to hear that. It makes a lot of sense to go through the.
Yep. And then, that can also help other communities. So, they're a statewide program, and, you can click what communities you're willing to volunteer in, and then you can, or what types of things you're willing to do, and they'll call you up accordingly. So, yeah, that would be the most helpful, and we're going to really push that out.
Fine.
Thank you.
Thank you.
Any other concerns? If not, our next meeting is February 4th. That's unreasonable for people.
Yep.
I'm just
Yep.
concerned
Good.
about Max and Karen and Kelly and the staff and whether you guys get enough sleep.
Yeah, well,
Kelly has a new baby to put on top of that.
This is
yeah.
wartime. This is wartime.
Yeah, absolutely.
This is wartime. You are in London and it's 1942.
Don't worry about Karen. We're going to Greece. We're going to Greece. They have COVID testing that they need help with while her son's there. So we're out of here.
The
We're going to Greece.
I'm an MRC volunteer.
But
We're
she
going
may
to
never
Greece.
come back.
Good night, everyone. Good night.
Good night, man.
Dancing on the beach. There you are, dear.
I think the only other item of business is a motion to adjourn.
so moved.
So moved.
Second. Bless your heart.
All in favor?
Aye.
Good on
See you on the 4th.
Good
Thanks,
night,
everyone.
Thank you.
Love you
Good
all.
night.
Stay,
Good night.
stay
Well, I'm
healthy.
president.